Hello, everybody, and welcome to our third month of our monthly webinars here with PA Foot and Ankle, Division of PACE. Today, we will be talking about how to take care of your feet during the summertime months as we're getting closer and closer to that time of year. Today with me, I have Dr. Zachary Mironov, who is one of our associates. He's been with us for about 2.5 years. Dr. Mironov is an ABF-AS board certified foot and ankle surgeon who specializes a lot in our foot and ankle trauma and reconstruction. He's our main trauma guy really in the practice. He obtained his Bachelor's of Science in Biochemistry from Bucknell and went to Temple University in order to achieve his Doctor of Podiatric Medicine. Currently, you reside, I believe, in Hellertown, PA. And like I said, he's been working with us for about 2.5 years. Will be three, I think, come August.
Yep.
Currently staffed at St. Luke's and Lehigh Valley. Does most of our work out of the Easton office, and works, hand in hand with the residents of podiatry at the St. Luke's campus. So Zach, I'll let you kind of introduce yourself a little bit more and kind of, I guess, let's get into it.
Yeah, thank you for the great introduction. Thank you for having me. I've never actually taken part in a podcast series, so I've been looking forward to this for a while. Um, so I'll get right into it. During the summer, it's beautiful outside and people want to be active, out and about, hiking, playing sports, beach trips, traveling, enjoying sunshine, etc. And these are all things that make life exciting. However, if you don't take proper precautions, it's only a matter of time until you end up with some sort of foot or ankle pathology. Today, I'm going to take you through some of the common summertime foot and ankle pathologies. We'll provide some pointers on how to prevent them and how to treat them. And we'll give you some general recommendations on how to keep your feet primed, pain-free, and ready for action during the summer. So starting off, some of the common summertime foot issues. So a very common one, and one I always like to point out is something involving skin cancer and skin cancer prevention. With summertime comes increased sun exposure, and people tend to forget about the feet when applying sunscreen. There's actually a study in 2004 by Laidman et al. It actually looked at sunscreen application at the beach, and they found that 50% of participants did not apply sunscreen to their feet, primarily to avoid sand sticking to them. So, this does happen. You know, Common skin cancers of the foot include squamous cell carcinoma, basal cell carcinoma, and melanoma. Daily foot checks are very important to help catch these early, leading to better outcomes. Not many people know, but Bob Marley, the famous reggae musician, actually passed away at the age of 36 from melanoma of the toenail. So these are more common than people know. So it's important to embrace prevention from an early age. Prevention generally includes application of sunscreen, as is an essential part of safely enjoying the outdoor activity in the summer. Too often, people skip their feet when applying SPF. Some people will forget, others figure that their feet won't be exposed long enough for it to be a problem. However, if the UV index is high, it only takes 10 minutes to really develop a sunburn. So make sure we're applying the SPF. Next, I'll take you through some sunscreen pearls. During sunscreen application, I want to emphasize that it should be applied to the entire foot, not just the top of the foot. Important to note that laying in the sun exposes both sides of the feet, so don't forget that area. Generally, SPF of 30 or higher is recommended. Anything less doesn't work, and dermatologists, they will also agree with that statement. Sunscreen should be applied every 2 hours at a minimum. And mineral-based sunscreens, such as those containing zinc oxide, they tend to be better sunscreens for the feet as they're more durable and water resistant than your typical chemical-based sunscreen. With that being said, make sure to reapply after going swimming. Some common brands that have the mineral bases are Blue Lizard and CeraVe, so make sure to look out for them. When to seek professional evaluation. So when looking at your feet, if you see any abnormal growths of the foot, toenail pigment darkening, pigmentation spreading from the nail onto the surrounding skin, lesion enlargement, when looking at these lesions, it's good to follow the standard A, B, C, D, E's of skin cancer. These stand for asymmetry, meaning the halves don't match. Border irregularity when looking at both sides of the lesion. It might be ragged or notched. Color variations, there could be multiple shades of brown. Diameter greater than 6 millimeters or pencil eraser size. And if you notice they're evolving or changing shape, size, or color, be sure to reach out so we can take a closer look. Um, it really only takes a simple procedure such as a shave biopsy to rule out anything serious. And the sooner you catch these things, the easier it is for us to treat.
Yeah, I agree. I mean, nowadays we don't know what's going on, right? You might have something there that's been there for a long time and you never really got too concerned about it. So a lot of people kind of just brush it off. I'm one of those whenever a patient comes in and I see anything that remotely looks abnormal, I biopsy it. I don't like taking a chance. How many times? I mean, Bob Marley, for instance, he probably had that growing for God knows how long before it actually got taken care of, and before he knew it, it was too little, too late. So, I'm a big advocate for biopsying anything that looks irregular, even if it comes back and just comes back as a mole. At least you know that it's nothing malignant and nothing that you have to worry about. But it's better to biopsy it, let it be benign, than to let it go and it end up being some kind of malignancy that um, ends up costing much more than a toe or a foot or whatever it may be. I don't know how you do it, once with you and your patients, we all have different protocols, but that's kind of my protocol. I like to biopsy and be on the safe side. That way, better safe than sorry type of thing.
100%. It's such a simple procedure. They heal up quickly and it,
Hmm.
provides some peace of mind. And, if it is anything severe, you get them into the right hands, whether it's oncologist or
Hmm.
if it's something we can handle in the operating room, we'll take care of it as well.
Yeah. And, a lot of times they don't even need stitches.
Exactly.
I've used steri strips. Sometimes I haven't had to use anything. So if we catch them early enough and they're small enough, it's a lot better to get it treated then than to kind of let it go. I really wanted to touch on kind of on what you were talking about with the sunscreen and everything. Um, as well as, with sunscreen and being at the beach and sand. I wanted to touch a little, I don't know if you're getting into a little bit later, but kind of diabetics
Hmm.
and those with neuropathy. I know throughout the summer months, we start to see a lot of patients like to walk outside barefoot. And those who are neuropathic, whether from diabetes or whatever it may be, aren't exactly the best judge of character for how hot cement or the concrete or the asphalt that they're stepping on is. And I've had, in the past few years, several people, unfortunately, requiring, I mean, some as severe as a below knee amputation,
Yep.
just because of getting burned on their foot. So, for those with neuropathy, um, never walking outside barefoot, even if you don't have neuropathy, you shouldn't be walking outside barefoot in the summer months, especially the past few summers have been, the sun's been uh, pretty vicious. It's been a hot, hot past few summers. Um, and I think, walking outside with some kind of slipper, flip flop, whatever it may be, some kind of protection is always kind of beneficial instead of running the risk of some kind of burn at the bottom of your foot. So,
Absolutely. I'll touch on it in a little bit, but
yeah.
at this point there are diabetic sandals, there are
Hmm.
diabetic beach shoes. There's no reason not to have footwear on as anyone with neuropathy.
Hmm.
They're making these special shoes and they even have support in them now.
Yeah,
So it's really important to wear them for prevention.
absolutely. All right, man, I'll let you continue.
All right, so moving on to the next common summertime pathology is athlete's foot or teniapitis. So this is a common contagious fungal infection of the foot that can lead to bottom of the foot scaling, peeling skin, itching, burning, redness, blistering, and excessive moistness between the toes. And it's oftentimes caused by warm, moist environments like locker rooms and sweaty shoes. You could pick it up from walking barefoot in public, at the beach, pool, gym showers, water parks. And if you don't treat this which many people don't like to treat it. They like to let it go because it might be asymptomatic, but it can spread along your feet and to other parts of your body, including your hands and even your groin region. So it is important to treat. Um, can be prevented by washing your feet daily, drying thoroughly, especially in between your toes. Keeping shoes and socks dry with antifungal powders, baby powder, or any other over-the-counter medicated powders. Rotating between 2 to 3 pairs of shoes to allow your shoe gear enough time to properly dry. And then addressing any underlying hyperhidrosis. This is a common one. Hyperhidrosis is excessive sweating. You can use products containing aluminum chloride. One of the prescriptions we use is something called Drysol, which has 20% aluminum chloride, and this really helps to manage that moisture down there. Treatment of the fungus will generally include antifungal creams, powders, controlling foot moisture. And if you're not responding to over-the-counter treatment, please seek medical treatment as uncontrolled fungal infections can progress to cracking and eventual superimposed bacterial infections that can really put you at risk for things such as limb loss. Um,
Yeah, completely agree. For us, I mean, by the time we see somebody for athlete's foot, they're beyond the point of mild, for the most part. They've tried over-the-counter stuff for the past several months. Nothing has been working. And like you said, a lot of them could get that superimposed bacterial infections, which a lot do.
mhm,
Um, and the thing with, with athlete's foot, sorry, um, people get that moisture buildup, especially in between the toes. And, you know, most people will just take over the counter topical antifungal, put it all over your foot, put it in between the toes, but that's actually incorrect, right?
mhm.
We don't want to put any type of moisture in the toes, between the toes, because fungus likes moisture. So the more moisture buildup there is, the worse that fungal infection gets. And I mean, for me, I don't know how you do, but a lot of times, a lot of these patients, by the time we see them, I put them on a short course of oral terbinafine just to kind of help fight that fungal infection that they have, and then put them on it for about 10 to 14 days, and then, as well as a topical antifungal. And they a lot of times continue that topical antifungal for about 4 to 6 weeks
Mhm.
before we finally start to get proper clearance, and then really teaching them the preventative ways of trying to deal with a lot of the stuff like you mentioned. Cleaning between our toes, making sure we're not having moisture buildup, stuff like that, um, is very, very common.
Yeah, I agree. Prevention is everything when it comes to fungus.
Mm,
So many times, like you said, people are coming in after trying everything and they have horrible, not just fungal infections, but it's already progressed to, erythrasma in the inner spaces,
yep.
moisture, wounds in the inner spaces that are now tunneling.
Yep.
When it gets to that point, there's definitely a good spot, like you said, for the oral antifungals, antibiotics. But if we can
Hmm.
prevent it from progressing to that point, with the antifungal powders, controlling moisture down there, obviously that's ideal.
Yeah, I agree. All right, I'll let you go. I won't keep interrupting.
Okay. So moving on to the next common pathology, dry or cracked skin. This is not just a summertime thing, but it's something that can be carried over from the winter due to the dry, cold air, or something that is new from heat and sun exposure associated with summer. Either way, this is something that can lead to painful cracks in your skin, discomfort, and potentially infections. Treatment, usually recommend consistent moisturization 1 to 2 times daily using creams or lotions containing either ammonium lactate or urea. Both these are either prescription or over the counter, so whatever works. My only caveat is that you should avoid over applying in between the toes, as this can foster fungal growth, especially during the summer months with the increase in moisture down there. You can use a pumice stone to gently exfoliate dead skin before applying moisture. Um, and then if you notice any redness or drainage from the skin cracks or that you are simply not improving, please come into the office to be evaluated and treated. Many times these skin cracks can lead to superficial infections that need management with either topical or oral antibiotics. So it's important to stay on top of them. Um, Now, moving on to the next common pathology, and this is something that we see almost every day, whether it's summertime or just during the middle of the year, but summertime heel pain, very common. During the summer, it's usually a result from a lack of support, whether it's unsupportive shoe gear, usually flip-flops or sandals, barefoot walking, lower extremity muscle tightness, and overuse. Common heel pain pathologies include plantar fasciitis, Achilles tendonitis, posterior tibial tendonitis, peroneal tendonitis, but they all have in common that they usually start from lack of support. Of that group of pathologies, the most common one is plantar fasciitis, which usually involves pain of the heel that is worse when you first wake up or when you start walking after being seated for a prolonged period of time. Prevention for these generally involve supportive shoe gear, orthotics, and consistent stretching exercises. When the over-the-counter modalities fail, your ibuprofen isn't helping, the support, the orthotics, make sure to reach out to your local podiatrist who will certainly be able to address your heel pain. There's treatments such as custom orthotics that we can get, steroid injections. Other options are the MLS laser therapy, shockwave, uh, prescription strength NSAIDs. There are so many different options. We take pleasure in getting you set up with a personalized care plan to help you recover. Um,
Yeah,
what are your
and
thoughts on heel pain?
well, like you said earlier too, I mean, there's so many new slippers and all that stuff out that have that arch support built into it, which
Yep,
I think has been actually very beneficial. I mean, I use them,
me
and
too. Yeah.
such a big difference. You know, a lot of people, I've been using orthotics, and probably for the past 20 years of my life. Um, and whenever I don't have uh, sneakers with the orthotics in, you know, I could feel it. And you know, ever since I started making a lot of these slippers, even different types of like Crocs and all that stuff, a lot of them are starting to be fabricated with the arch support, which I think has been actually very beneficial for people. And you know, I do recommend them to a lot of our patients that we see, especially as the summer months come. You know, a lot of people like to be just in sandals, open toe shoes, whatever it is. Um, which is fine, but you know, we want to make sure we are not lacking in that support system in order to prevent things like plantar fasciitis, heel pain, or different types of aches that we might have in our foot and ankle.
Yeah, absolutely. It seems like every flip-flop or sandal company is really getting into the support game. I've seen, I think Costco had 3 or 4 different brands of flip-flops when I was looking this
Oh
last
wow.
week, and all of them had built-in arch support.
Mhm.
I'd never heard of any of them, but they all were very supportive. I know
Yeah.
Archie's is a common brand. Reefs is even getting into it. So as long as you're getting some sort of support, it's better than nothing.
Yeah, no, absolutely.
Okay, so my next common pathology that I'll focus on are warts or verruca. Uh, so these are caused by a virus and are more common during the summertime months because of the amount of pain or people walking barefoot. These can have the clinical appearance of a painful callus with visible black dots. And as I said at the beginning, there's no reason not to have shoe gear on, but these can be prevented by wearing uh, footwear such as flip-flops, sandals, and pool or beach shoes at all times. Treatment involves destroying the skin overlying the wart to get your immune system to respond to the area. There are many different over-the-counter options. There's salicylic acid liquids, pads. There's freezing with liquid nitrogen. However, warts are very stubborn, and these are oftentimes not enough. I prefer to use a chemical called cantharon in the office to manage these and tend to have a lot of success. But again, there are many options out there, all aimed at trying to get your body's immune system to respond to the area. Um, if you're having any trouble, don't hesitate to reach out if you need professional treatment. Um,
Yeah.
do you use cantharon as well, or what's
Yeah,
your
I like Canthrone. I think Canthrone honestly works the best. The only thing with Canthrone is sometimes it could cause that blistering mechanism that
Mhm.
causes some discomfort for patients. But as long as you give them a heads up about it, I think they expect it. It only really happens like 10-15%, I feel like, of the patients. It's not often.
Right.
But when it does happen, it can be uncomfortable just
Absolutely.
because you're walking on a blister, and unless you drain it, you know, it can cause discomfort. But I feel it's weird. I don't know if you've picked up on it, but I feel like every time a patient comes back and says they had a lot of pain and you debride the callus or dead skin that's in the area, the wart is gone. Um,
Oh,
s-
100%. I try and put enough on to cause a blister almost every
yeah,
time because
yeah,
if you
exactly.
don't if you don't cause some destruction to get the body to respond, you're not doing your job. So if they say they didn't have a blister, then I'm more inclined to, do a little bit more the next
Yeah,
treatment.
yeah, no, I
But
agree. And
100%, just make sure you're always giving your patients a heads up about
yeah,
blistering.
and like you said, I mean, warts are stubborn, stubborn. I mean, I've the tiniest of warts have taken me weeks, and I've had the biggest of warts respond within like 2, 3 treatments. So, I know a lot of patients probably ask, well, how many treatments is it going to be, or how long is it going to take? I wish there was a way for us to really predict that. There's really no way of predicting how well the body responds to the treatment. Um, Kids, I find, kind of respond a little bit quicker than adults, but that's just in the nature. They heal well with pretty much everything. But I agree, man. Warts are very, very stubborn to deal with, and a lot of the over-the-counter stuff, um, I personally don't like. I just telling people to apply like salicylic acid an acid to a certain part of their body without really knowing the effects of it kind of scares me.
Right.
I've seen a lot of like both diabetics and non come in with wounds because of the salicylic acid. So I
Yep.
kind of tread very lightly to recommend that type of stuff over the counter. I just don't like it.
Mhm.
I rather, come in, get it professionally taken care of. That way we can monitor it, make sure an infection doesn't happen, and so forth. But I think that's really the best route to treating warts and not delaying it too much. Because if we do, that's when their stubbornness kind of increases over time. So
Absolutely. And most of the over-the-counter stuff alone isn't even very strong.
yeah,
So it's kind of a waste of time. And like you said, if you do start treating it with something strong and you're not really sure about the what's going to happen, they're definitely at risk, especially if they're diabetics who are
yeah,
prone to wounds to
absolutely,
begin with.
absolutely, man.
All right. So moving on, my next common pathology that I'll focus on is actually just general sports injuries and trauma. So the beautiful summertime weather tends to bring out the so-called weekend warriors, which are those people that participate in intense physical activities such as sports or hobbies only on the weekends or during limited leisure time due to other life commitments. So, they're not very active to begin with, but when it's nice out, they start really going full throttle with these activities. Because of this, there tends to be many acute musculoskeletal injuries that occur due to the lack of proper stretching or conditioning. These can include tendon ruptures, ankle sprains, broken bones. And it can also be an underlying cause of chronic conditions as well, such as tendonitis. So it's not just the acute stuff. Um, with these types of injuries, the sooner we can diagnose and treat, the better the outcomes tend to be. So if you have sustained one of these injuries, make sure to make an appointment for evaluation, x-rays, and possibly even advanced imaging if needed. This will get you onto the faster road to recovery. Um, Prevention, just make sure you're doing proper conditioning and stretching before you start getting into full activity. Make sure you're getting plenty of support. If you know you normally have an unstable ankle, wear a lace-up ankle brace, things like that. Again, we're all about prevention. But if it does happen, give us a call.
Yeah, no, I agree. I mean, this is the time of year when we start seeing more ankle sprains and unfortunately tendon tears or ruptures or
Yep.
whatever it may be. And a lot of it is just improper, I'm sorry, support for one's biomechanics. And also, like you said, that weekend warrior who hasn't done anything all winter, then with just wants to go out and start running around, playing basketball or whatever it may be. It's just, stretching, stretching, stretching is very key. Like you said, proper support, whether it's a lace up, orthotics, or whatever it may be, in order to support. Even honestly, cutting grass on uneven terrain
Mhm.
can also cause these different injuries. Just, I know a lot of times patients will say, and I've done so myself, for yard work, everybody's wearing an old pair of shoes or old pair of sneakers that has completely lost their support system. And a lot of times it's stuff like that is preventable by just getting a newer shoe, even if it's a cheaper type of a shoe, but just something that has better support while you're doing outdoor activities instead of using, worn out shoes that no longer have that support system to it.
Absolutely. All right. So moving on, I'm going to start talking about just some general summertime recommendations. So the first one, and you kind of alluded to this before, but you should avoid or limit your time walking barefoot. Uh, Being barefoot could be one of the best parts of the summer as it lets you be carefree and really get in touch with the sand in winter or sand and water. However, walking barefoot increases your risk of injury. Oftentimes, again, as you said, surfaces like parking lots or boardwalks are much hotter than they may appear, and you don't want to risk burning the bottom of your feet. And this is particularly true in our patients with neuropathy, as you might not feel the feet burning, resulting in severe wounds, infections, risk of limb loss, things like that. Additionally, spending lots of time barefoot increases your risk of things that I just discussed, such as athlete's foot, bacterial infections, plantar warts. So protect your feet from hot surfaces, injury, fungus, plantar warts, etc., by wearing some sort or some element of shoe gear. Particularly though on any shared high traffic surfaces such as pool decks, hotel hallways, bathrooms. Um, Beach or swim shoes are a great idea in the beach or pool setting, especially for the high-risk patients. On Amazon, there are several brands that claim to be diabetic water beach swim shoes that are supportive, breathable, non-slip, quick dry. These brands even have wider shoe width options to prevent rubbing on any forefoot deformities such as your hammer toes or your bunions. Um, My next piece of advice for the summer, invest in supportive summer footwear and think of your feet when planning your summer activities, as every activity requires different shoe gear needs. Your feet are the foundation of your body and they provide support needed for movement. Without proper care, you risk pain and injury, and not just in your feet, but also in your knees, your hips, your neck, your back, your shoulders. For long walks and physical activity, supportive sneakers are your best bet to prevent injury. These include your Brooks, Asics, New Balance, Hoka's, etc. In addition, adding an orthotic or supportive shoe insert will ensure for proper biomechanics during walking and help to reduce your likelihood of overuse injury. Um, you should choose sandals with arch support, avoiding completely flat, flimsy flip-flops for long walks, which can cause strain. You should wear sandals with thick soles and straps instead of flip-flops to provide more support and reduce your risk of falls. Um, another thing, you should make sure you break in your new sandals slowly to avoid blisters. Hopping right into new sandals is one of the more common summer foot mistakes. It is understandable to be impatient when you want to wear your new sandals, as your feet have been stuck in closed-toed shoes for several months before sandal season has arrived. People will oftentimes put on brand new sandals before a long day at the beach or exploring a vacation just to end up with painful blisters from the straps. So just like boots or sneakers, new sandals should be broken in gradually to avoid injuring your feet. And by gradually, I mean multiple short spells at the beginning, even if it's just walking around at home until they're more broken in. This will reduce your risk of injury and blisters. For your diabetic or at-risk patients that prefer sandals or flip-flops, there are specific diabetic sandals, such as those carried by the healthyfeetstore.com that I found. These are either Fisherman style or Mary Jane sandals with vents or cutout sections on top of the vamp for improved aeration without creating entryways for sand and pebbles that can cause injury to the soles of the feet. And these are also optimized to prevent irritation that can lead to blisters and calluses. Um, Thong sandals or flip-flops are not recommended for diabetics, particularly those with diabetic neuropathy, because of the risk of damaging the thin skin between the toes. Open heel sandals, these are also not recommended because of the risk of developing heel calluses that may crack and become infected. Um, my next major pointer, dry your feet before putting on your shoes. While flip-flops and sandals may be the more common trend during the summer, many people will put on their sneakers after leaving the beach or pool. If you do, make sure you thoroughly dry your feet before putting your socks and shoes back on. In addition, packing an extra pair of socks is never a bad idea. This will help prevent you from walking home with wet feet. And keeping your feet dry will help prevent bacterial and fungal growth, which will not only help prevent infection, but also keep you odor-free as well. Next, you should choose your socks carefully and perform proper sock care to allow your feet to stay cool during the summer and prevent unwanted discomfort, foot odors, or infections. Make sure you choose breathable fabrics. Cotton or moisture-wicking socks work best to keep your feet cool and prevent sweat buildup. In the store, sometimes they'll label these type of socks as your diabetic socks. Uh, Make sure you change your socks daily and avoid reusing the same pair without washing them first. This will reduce bacteria and associate odors. Um,
With you mentioning that, I just want to make a point
yeah, of
that
course.
just because they're called diabetic socks, they are not only for diabetics. I get that question often, but they're geared towards diabetics, but just because they're diabetic socks, they do work well with the majority of the population anyway, because of uh, the fabric that they're made of and how breathable they are and things like that. So that's the only tidbit I wanted to chime in on.
Absolutely. Um, so the next pointer, and this is a big one, especially where I came from doing my residency training down at the North Jersey shore where there's lots of beaches. But please avoid the water if you have open wounds or deep cuts, especially in our high-risk patients. And this might sound, tedious during the summertime months, but whether it's the ocean, pool, or freshwater environment, there are bacteria that will find themselves into your open wounds, leading to infection. Some of these bacteria can even cause necrotizing infections that could put you at risk for limb loss, whether you are an unhealthy elder diabetic or a young, extremely healthy individual. It doesn't matter. So please use your discretion. I saw lots of healthy people, lose toes or parts of their feet from bacterial infections from the ocean, just because they had a little cut that they thought was nothing, but they didn't pay much attention to it and went to the ocean. So if you are adamant about going in the water, please at the very least use a cast cover to keep your wounds from getting submerged in the water. But if you want to be safe, just avoid the water altogether if you do have an open wound. Um, any thoughts on that?
I agree. We uh, especially in around this area in where we're at, like Lehigh Valley, there's a lot of little creeks and canals and all that stuff that are nasty,
Yep,
infected water a lot of times, and people still go swimming in them in the summer months, which is fine, but like you said, if you have any type of deep cut or anything like that, you need to cover it up. If any of that bacteria gets in, it's not only diabetics that can lose limbs, unfortunately. If we're not taking the proper precaution, and we have these types of wounds, we too are at risk of furthering bacterial infection and going down a spiral effect of, needing something unfortunately surgically done or IV antibiotics or, a hospital admission that could have been probably prevented. So I 100% agree with you. You know, it could happen in both healthy and as well as unhealthy individuals, but we all need to take the same precaution.
absolutely. All right, my next piece of advice, and this is for all the planners out there, be extra prepared with foot care products. Whether you're going on vacation or hang out on a day trip, it's always a smart idea to bring first aid supplies. And along with the normal first aid supplies, such as Band-Aids, antibiotic ointment, ibuprofen or Motrin, ice packs, you should also bring a few extra items that will help take care of your feet should any problems arise. These include blister pads or moleskin, toenail clippers, emery boards to smooth the rough edges on broken nails, pumice stones for any painful calluses, aloe vera or Silvadene for sunburns. Any other items you recommend?
Um, that's really a bulk of it.
Hmm.
You always want to, and a lot of the guest services and the whatever hotel you're staying at, a lot of them have these items in the shops. But it's better to plan. That way you actually have all of this instead of running around and looking for it, especially if you get a cut or a blister or whatever it may be. Um, But a lot of it comes down to planning and proper shoe gear, like you've been talking about. Not pulling out your newest sandal and going to walk on the boardwalk for 2 hours. A lot of the stuff we kind of frown upon,
Hmm.
um, just because we've seen what it does to a lot of individuals and a lot of patients. So really, taking that precaution is the biggest key whenever we go on vacation, and making sure we do have the proper materials in order to, I would say, doctor ourselves if needed. So.
All right. Um, so my final tidbit on recommendations involves pedicure safety. So in general, anyone that talks to me about pedicures knows I'm not a huge fan of nail salons due to the increased risk of fungal or bacterial infections. However, it's the summertime months, and I do understand that some people prefer to have their toenails cared for and painted. So if you're going to get a pedicure, please ensure that the salon sterilizes their tools, ideally with an autoclave. And I actually recently learned from my wife that you can actually bring your own set of tools with you,
Mhm.
which that's an excellent idea
Yeah,
if you
I,
do
I
enjoy it.
recommend I recommend that to everybody. Just take your own tools. That way, and then you're taking them back home. It's only being used on you. But invest that little bit and take your own tools if you really need to go to the nail salon. But like you said, making sure that the cleanliness um, of the tools and making sure they are being sterilized before utilizing them on you or one of your family members or whatever it may be. And just being on the safe side, we see a lot of ingrown toenails as well that happen after nail salon trip, which um, I'm not gonna say can be prevented, but we need to be on the safe side whenever we go to different facilities for these type of um, leisure activities. But I tell everybody just take your own tools. It's so much easier, so much cleaner for you. So.
All right. Thank you. So just wrapping things up, in conclusion, taking the care or the time to care for your feet in the summer months can help you avoid discomfort and stay active all season long. With proper footwear, support, prevention techniques, daily foot checks, your feet can enjoy a healthy and pain-free summer. However, if you are experiencing any foot issues or need personalized advice, do not hesitate to come in and see me or any of the other wonderful physicians here at PA Foot and Ankle Associates. We're more than happy to take care of you.
Yeah, absolutely, man. Well, that was great. Thank you for that tidbit, especially as we get closer and closer to the summer months. I will open up the floor to see if anybody has any questions before we wrap up. Um, but we are reachable at 610-330-9740 for anybody that does have any questions or needs to speak to any of the physicians here or to make an appointment. Don't My biggest tidbit to patients is don't let stuff go untreated for too long. If it's something that's inflammatory and you're having pain, a lot of times it's not going to go away by itself. If it's infectious, that's definitely not going to go away by itself. So, if anything's going on in your foot and ankle or toes or wherever it may be, give us a shout, give us a call. We are more than happy to bring you in to evaluate you, make sure that everything is healthy and going properly in your foot and ankle and biomechanics and everything like that. It doesn't take long to get an appointment with one of us. We always have slots available for especially emergencies that may happen. Um, but other than that, man, I appreciate it. I look forward to hopefully the next webinar that we do. Thank you all for logging in, and we'll see you in our next webcast.
Yes, thanks for having me. Thank you, everyone, for coming out and enjoy the rest of this beautiful day.
Yeah, you too.